In this video, I'm going to explain what is meant by the term not enough bone. So generally speaking, when people are losing their teeth, one of the main reasons people lose their teeth is they lose the bone that holds their teeth in their mouth. So imagine every tooth you have has a root. It was held in your mouth by bone. For a lot of different reasons, we can lose the bone, and if we lose too much bone, the teeth get loose, they get extracted, we end up in dentures. Now, when we're in dentures, what the dentists haven't done a great job of telling the population is that the bone will start to shrink after teeth are extracted. I mean, studies have shown that you can lose 40% of the bone in the first year alone after your teeth have been extracted, or even a single tooth, the bone will start to shrink in that area. So as the bone shrinks, it becomes more and more difficult to put an implant in bone. You see, implants need bone the same way a screw needs wood. So if you're putting screws into a wall, you need a certain thickness of the wall for the screw to go into, and the jaw bones are the same way. So you need a certain thickness of bone for the implants to go into. And when the teeth have been extracted, the bones start to shrink over time, and you need that height of bone and thickness of bone to place the implants in. Now, thankfully, even if your bone has been shrinking for 50 years and you had your teeth out 50 years ago, it's been shrinking the whole time. With advances in both the way we place implants and other procedures, you can still be a candidate for implants. I'll tell you just a little bit about that. So for instance, if you've had your teeth out for a long time and are concerned that you don't have enough bone, well, when you come into the appointment, we can do what's called a bone scan, and we can tell you exactly if you have enough bone or not. And if you do have enough bone, some of the new tricks that we're able to do, we can take implants and angle them on the side to allow us to go into where there is bone and avoid you having other procedures. And if that can happen, there are other procedures where we can harvest bone and add bone to bone deficient areas or areas where you don't have enough bone. And we can do procedures where we can take bone. Now, traditionally, these were only done from the hip, where we take and graft bone, but now we can actually take bone from inside the mouth and pack it in. We have bone in a bottle and all kinds of really cool different options to allow you to have the bone that you're missing in order to have dental implants. So these days, thankfully, most people are candidates for dental implants with the advances in dental technology over the last few years. So in this video, I explained to you what is meant by bone loss and some of the options you have if you feel you've lost a lot of bone.